We looked at these cancers of the breast and cervical cancer. The cervix is the lower part of the womb, the uterus. And these are cancers that are quite common in our days. When I was a medical student, we hardly saw cancer patients, breast cancer. We could count them on one hand. But right now, we have so many people. I'm sure you and I know at least one woman that has had breast cancer or have died from it. Raised blood pressure, blood clots leading to sudden death. And I told you the story that was passing around recently about a 31-year-old lady that suddenly dropped dead after doing her PhD. She was married with 2 children. And the reason was she had blood clots in her brain, thanks to the oral contraceptive pills she was on. And then strokes, heart attacks, depression, migraines. These are very common side effects. Increased risk of contracting and transmitting sexually transmitted infections. Now we're seeing infections that in the past were gradually phasing out in the history of mankind, like gonorrhea is on the increase. Chlamydia. Chlamydia is an infection that usually when the woman has it, it doesn't have symptoms. It's quite painless and symptomless. The only reason why you will know that this woman has ever had chlamydia is when it's time, when she starts looking for children and you do all those tests and you realize that her tubes are completely sealed up thanks to chlamydia. So it causes infertility. And then of course the HPV virus, human papilloma virus, which even with the use of condom you can't prevent because it comes with contact between the 2 people. So it's not something that using artificial contraceptive prevents, because actually it increases the risk of contracting it. Because as I said before, the artificial contraceptives, especially the hormonal ones, destroys or at least makes the immune system not to function as it should. And above all, we said that they all cause abortion. So they are abortifacient. They cause chemical abortion, even if the woman is not aware of that. So I thought we should have a brief look at breast cancer effect of oral contraceptives. When a woman takes oral contraceptive before the birth of her first child, which is what is happening now, if you go to the university and take a statistic, most of the young women are on oral contraceptive pills. They have no intention of getting married, but they're on the pills. The same thing with our teenagers. We have a 44% increased risk of developing premenopausal breast cancer. And this will increase to 52% for women who took it for at least 4 years before the birth of their first child. So now you can understand why we have more women having breast cancers. And then the American Cancer Society, if you go to the website, it tells us that oral contraceptive pills are known human carcinogen, group 1, meaning that they are quite common, that they are causes of cancer. Here is their website. You can check it out yourself. The number 4 thing there is the one my arrow is pointing at, estrogen, progesterone, oral contraceptive, the combined ones are listed as part of human carcinogen.